Health literacy is the ability to understand health communication. It's the ability to access health services and actually navigate in the health systems. My name is Helle Terkildsen Maindal and I'm a professor in health promotion at the Department of Public Health here at Aarhus University. Because we work with applied public health, doing intervention studies, we have quite a lot of experiences with working with different partners. That could be citizens, regions, municipalities, even sports clubs, NGOs and so on. So we have quite a long tradition of working with different organizations. We have a shared interest with the National Board of Health of making it easier for people to navigate in health systems. So they wanted to make a kind of a guideline for how to be a health literacy responsive organization. So in the real world, it should be a kind of a guidance for health organizations to work much more targeted with health inequity. They will have sort of concrete cases and examples and evidence on how to increase their responsiveness to people's different health literacy levels. We had a really close writing collaboration. They framed sort of the overall report and we wrote the evidence-based content of that, and they provided cases and so on. But we also had to make mutual expectations very clear, because we are two very different organizations, and as a researcher, I really, like to say everything with precaution. Whereas the National Board of Health, they wanted us to say what is the fact and how can we communicate this in a brief and very easygoing way and so on. So that was some of the discussions we had along the collaboration, but that definitely those discussions also make us understand each other much more. So there was a huge output in that way. It's so meaningful to actually see it being used out there, and that's probably the best acknowledgement you can get as a researcher, that other people actually gain from what you spend all your hours working on.